Brittany, you mentioned before that the challenge we're seeing in the facilities often now is that there are far more acute level patients. It's taking more staff hours to care for those patients. And really, we just don't have the same patients in those facilities as we did when maybe you were an administrator. Mm-hmm. Talk a little bit about that, why those patients just don't exist anymore and why we're seeing a different type of patient.
Yeah, if you look back 5-10 years ago, the types of patients that were in assisted living facilities who were just very obviously they had to be there for a reason, but the patients that were fairly easy to take care of, those people are just encouraged to stay home and that family members can take care of them.
There's a lot of technological advances where people can get taken care of in a home setting now.
Yeah,
right?
A lot more accessibility for home health and hospice and at home and different things like that. So a lot of the patients that used to be, if you will, easier in skilled nursing facilities have now kind of gone into assisted living facilities, and they're able to kind of take care of those people. So now the people that are coming into skilled nursing facilities, we're seeing a lot more behavioral patients, people with history of substance abuse, drug abuse, mentally ill patients, things like that. And we're having to train our staff to adjust and to pivot so that we know exactly how to care for those types of residents.
So the entire landscape is changing, right? Which, in my mind, that means that we need to adapt, we need to change as technology has changed and facilitated people being able to be in the home to get some of these more minor treatments done. There still needs to be communication there, right? But now the landscape has changed and skilled nursing facilities are seeing a much more complex patient.
Yes, absolutely. It's just we're not seeing as many just simple knee replacements coming for a quick rehab stay. Right. They're being encouraged to go home, or hip replacements, things like that. We're seeing a lot more long-term care patients, which is great. We love all of the long-term patients. We love any patient that comes into our facility.
Sure. But it does require a lot more work.
It requires more staffing hours.
And more coordination.
Mm-hmm. And that, I think, is the biggest problem is staffing hours actually increased during the pandemic. Yeah. People required because they were getting sick. People are having COVID, and staffing hours actually increased. So we were providing more care to all these patients because they needed it. And facilities luckily have been able to kind of adapt as the waves come and go. But now we're kind of just seeing that people aren't wanting to be in the industry anymore. So we're really needing to lean on our legislators, and the American Healthcare Association is like our parent association, if you will. It's the American Healthcare Association mixed with the Long-Term Care Association that represents nursing homes, so the National Centers for Assisted Living. So both of them combined, they, with us and ACA and Cal, we really fight and we lobby for all of these facilities to really come up with creative ideas to keep our staff, and to talk with legislators to say, hey, maybe we can do different incentives for people, like, I don't know, small things like loan forgiveness and things like that, to encourage people to work in the long-term care space so that we can, really entice people to work there, because it really is such a great place to be.